everybody, to our latest video where we've been joined by some of the caregivers of lung transplant patients, and we're just going to introduce ourselves so that you know who's talking to you. And then we've got a couple of different topics that we thought might be useful to share. So my name is Wendy Jenkins. I'm a part of the Lungitude Foundation who's bringing you this video. I actually had a double lung transplant about 14 years ago. So you might be thinking, why is a patient interviewing these caregivers? But it's actually part of what I do at Lungitude, and I'm actually going to be very interested to hear what the caregivers have to say. Now, we actually use the word caregiver instead of carer, but it's it's interchangeable, but that's the word we've chosen to use. So I'll start with Ian. If you'd like to just do a bit of an introduction, that would be great.
Hi, I'm Ian. So my wife had a double lung transplant back in 2017. Had cystic fibrosis from a kid, but had I suppose it wasn't necessarily a planned thing. She got quite sick with the flu, so it was a very rapid transplant and then the emergency transplant at the Alfred Hospital. And we were in hospital for about 12 months with that, so she got quite crook. And because of that, she needed a kidney transplant in 2019. So through that time, I provided a lot of care to her, especially during times that she couldn't care for herself. However, she's doing really well now, and my activities become very light, which is good.
That's excellent, yeah. And and while we talk today, you'll hear pros and cons. Like, we're not going to sugarcoat it. If you know, there's always good and bad about having a lung transplant. So we're just going to share stories, and everyone can hopefully relate to different parts of it. So I'd like to go to John next. If you'd just like to share your story.
Hello, I'm John, and I'm a caregiver for my wife Helen. Helen is in her 9th year, and she was transplanted in 2012, and she had a condition out of the blue called dermatomyositis. It attacked her skin, her muscles, destroyed her endurance muscles, and finally touched her lungs and ate both of them in a matter of 6 weeks. So we were just thrown into it straight away. There was no waiting list. I was filling out the forms while she was being prepared to either go to ICU to be put to sleep forever, or if her blood matched, into the operating theatre. So that's how quickly we moved into it. And she's, like I say, in her 9th year, and she's doing okay, although the conditions before the transplant was acute, and now it's long-term chronic. So she's not the same person she was then. And like you say sometimes, Wendy, she was Helen 1.0, and after the transplant, she's Helen 2.0. And that has implications on our lives, and certainly on her life.
Yeah.
So that's what I like to do.
And that's very true with John. It is one thing I talk about a lot, that when you have a lung transplant, you know where you were perhaps heading in the past, or the person that you were, the outlook you had can change, and you can become this version 2.0. It's not necessarily a bad version, it's just a different version, but a lot of people forget that the caregiver goes on that journey as well, and so it can really impact family and partners, etc. And that's why we wanted to do this, so we could just share some of that. So Rihanna, what's your story?
Hi, I'm Rihanna. I am a carer for my mum who had a transplant in 2016, double lung transplant. Her transplant came about after a long illness of chronic emphysema and COPD. She spent over a year on the waiting list. So things happened slowly and were very drawn out for us.
All right. And you're now part-time carer for your mum, I believe, is that right? And you've got a couple of kids as well?
Yes.
Yeah. So trying to juggle everything there. Yeah.
So we made the decision with mum to move her into aged care when it got to a point that caring for her was having a significant impact on mine and my brother's life and on my kids, and the time that I could spend with them and the things that I wanted to do with them as a parent, and that she wanted me to do with them as their grandmother. So we made a family decision for her to move into aged care, but I still do all the appointments and specialists and coordinating all of that for her. But the day-to-day care now is no longer on my plate.
Yeah. And look, you do have to make the right decision for you and your family, and there's lots of different ways you can provide care. So that's really good to hear that that's one of the options that people might want to consider. And then we have Bernie. If you'd like, not lucky last, like to share your story.
Sure. So my daughter had a heart and double lung transplant in 2014, and she was 5 at the time. So and that came quite suddenly, because when she was 4, she became sick, and we found out she had a congenital heart defect and pulmonary hypertension. So she was unwell for about 12, 14 months, and then was put on the list at the Alfred, because the Alfred do heart and lung blocks. And initially they said she was too small to be transplanted when she was sick at first. But then after 12, 14 months, they were able to put on the list, thankfully,
Yeah, that one must have been a relief as a parent. I think there's always a layer of complexity when it's your child, in there, and there's so little as well, because I think she was the youngest and the smallest to have lung transplants, heart and lungs. So that's, and she's back at school and everything, which I'm sure you'll share later. So thank you everyone for the introduction. So we're just going to go around and share a couple of tips, because that's one of the things that caregivers are looking for. So why don't we mix it up, and we'll go to Rihanna first. What are some of your tips you'd like to share?
I think the biggest tip for me that I could share is not to be afraid to ask for help yourself. When we were going through the process leading up to Mum's transplant, and meeting with the transplant team and the nurses and the specialists on a regular basis, and they tell you about the amount of appointments you're going to need to attend in the days and weeks immediately after the surgery, and when you're released from hospital, and what that's sort of going to look like. I felt like I had to sort of morph into this superhuman who could do everything, because that was my mum and she needed me, and there was no one else, or I felt there was no one else who could do it better than I could do it. And I realised really quickly that I had to lean on my support network, because particularly in those weeks after being released from hospital, where she had to attend physio 3 times a week, and we lived at the time over an hour from the Alfred, so it was a bit of a mission getting in and out 3 times a week. I was able to rely on some family members, and I was really lucky that I had a cousin who was on maternity leave, who she did one appointment a fortnight, and my mother and father-in-law did 1 a week. My brother was able to negotiate down to 9 days a fortnight at work, so he could do one. So by sharing the burden, it made it much more achievable.
Yeah, that's a great tip, because I think you're right. I know my husband was, speaking on his behalf, but I know he was a bit the same initially, and then everyone rallied around and said, no, we can do that one, we can take it. And I had all sorts of, family and neighbours and all sorts of people running me to gym. So, that's a really good tip. Excellent. And Ian, what's one of your tips you'd like to share?
Probably one of the tips that I've found, and probably like a lot of especially patients or loved ones that have had a chronic condition, a lot of times they're their best advocate early on. And in my wife's case, where there were long periods that she was on ventilators and on ECMOs and ICU, she couldn't be her own advocate, so I had to become that. So one of the key tips is don't be afraid to speak up. Don't be afraid to ask for a second opinion if you don't feel you normally know your loved one the best out of everyone. And if things aren't right, or if they're not in the condition that you thought, or they've changed or something like that, a lot of times you provide that bit of continuity of care between, doctors coming in through rotations or nurses coming in, and don't be afraid to speak up and say, I don't think this is right. I've got stories that many times that just that little thing of just saying, I don't think Nicole's right at the moment. Something's changed. And that would be enough for them to go, right, let's actually look at this. Let's change something.
Yeah.
So don't be afraid to speak up, and don't be afraid if you think something and you need to go. There's so many wonderful doctors there, so many wonderful nurses, and don't be afraid to speak and ask for a second opinion if you just feel something's not right. That can be all the difference that can, save a life, or even just make things a little bit easier for everyone.
Yeah, and that's a great tip, especially getting the second opinion, because often doctors will have a different approach, and so one will be like, oh, you could try this, and then another one might go, well, I've had another patient that was similar and this happened. So I think it's actually a really wise tip to ask around and get to, and all the doctors, they'll have their own little way of doing things, but excellent.
It's a really great point about bringing up about that sort of different approach with doctors. I remember, and don't be afraid to sort of say, yeah, we've tried that didn't work last time. But then they go, okay, let's pull the second thing out of our arsenal that can help. So, definitely.
Yeah, no, that's right, because they're just working on the data they have. So the more you can give them, the more of an informed decision and they can actually make. So, that's great. John, what's a tip that you'd like to share?
Well, I'd like to follow on from what Ian said, from the point of view that I became a carer virtually straight after she got out of ICU, because I found out that the hospital is not like the transplant ward is a low care ward. Most people leave in 2 or 3 weeks. Helen was in here for 9 months with 1 foot in the grave and 1 foot in this world. And they didn't have the nurses enough to respond to everybody on the ward. So I was in there every day from 10 o'clock to about 9 o'clock every day. And what I did was I took notes. When the doctors came in, I asked questions. And I found that the doctors are very open to talk to you, but they're just as afraid of asking you or talking to you as you are of them. And so I would ask questions, and there's no stupid questions. They were very helpful to explaining things, and I used to take down notes. So what Ian said about, the second opinion, Helen's going through her 3rd lot of aspergillus fungus in her lungs. Now, when they give her the posaconazole to fight it, it has another effect on her cyclosporin. A lot of people on tacrolimus, but she's on cyclosporin. And I keep notes on what happened in each case. So if a doctor comes up and he's going to give her so much posaconazole, and I know what the result was last time, I bring it to their attention, not in an adversarial way, but in a helpful way, because they can't go through volumes and volumes and volumes of your history to know all the things that you should know, because, you are responsible for your own health. And in my case, I'm responsible for Helen's health, because the sick person can't take notes. They're getting treated. They're in a world of their own. They're upset. And so as a carer, I take notes. I attend all the meetings. I share things with the doctors, and they do appreciate that, and I appreciate it. And Helen doesn't have to suffer as much as she would if everything was tried new, because medication works same dose on 2 different people works totally different, and it reacts with other medicines to do totally different. So note taking is one thing that I found out, because you can flick through the pages and say, oh yes, Dr. such and such, and her team did such and such and found this. They will go through and they check, but they're appreciative that you give them a timeline to go and look at. Because like Helen's in her 9th year, that's a lot of paperwork.
It would be.
The other thing that I did was, I have a spreadsheet of all of Helen's medications and her scripts and what the medications are for, because that's another thing. You can get so confused with all these medications when they run out at different times and all that sort of stuff, and they've got different names, and some of them you're not supposed to have generic and others are okay generic. So I think for people who don't have a carer, this must be extremely difficult, and I would say that's probably one of the reasons why some of them die so early, or before they could, because they haven't got anybody to support them. People post-transplant do need a lot of support.
Yeah, no, that sounds like you're super organised, and I think you're right. The amount of different drugs and tablets, I used to get my husband to actually do them occasionally, just to learn what I was having, and we had a shared sheet that we'd use as well. So yeah, no, that sounds like Helen's in good hands, John. Sounds like you've got her organised.
She's very valuable to me.
Yeah, of course. You don't want her going anywhere. So whatever you can do, and I think that's one of the things as a caregiver too, is that in some ways you can feel a little like you're not in control in a lot of situation, because the patient knows best how they actually feel, and whilst they can tell you I'm feeling this or whatever, you're not the patient, so you do the best you can under the circumstances of understanding where they're at. And so where you can provide help and put some control around what's going on, I think that's really valuable. So yeah, that's good tips. Excellent. And Bernie?
Yeah, I was as well seconding what John was saying with the note-taking. Like when we started off at the outfit, they gave us a book, and I found that so useful, just with every appointment, and just little things of just noting down, and as well having posaconazole, and that as well happened to us. And I think that was really handy, just being able to flick, on this day our tacro went up, and so I also found that was very useful.
Yeah, no, that's great. And did your daughter spend time at the Children's Hospital as well, or was it mainly at the Alfred?
Well, prior to transplant, she spent time at the Children's, but after transplant, it's been mainly at the Alfred. Yeah. Well, at the moment, she's having treatment at the kids, but yeah. Back a bit of back and forth. Yeah.
Yeah, and again, you've got even more specialists you need to make notes of. So yeah, I think that's a wise decision. Yeah. Excellent. Well, that's great. So I thought we'd now just briefly touch on what you wished you'd known earlier, because often in hindsight you look back and you think, oh, if I had known about that. So I thought we'd talk about that. So maybe Ian, did you want to go first on that one?
I suppose one of the big things for me, there's a couple of things that I would have loved to have known. Firstly, I think because of the way we went into it, very surprisingly, and it goes back to that mention about self-care of the caregiver, but it's going to be a marathon. It's not a sprint. I know at the start I jumped into it really, all right, I've got to do all-nighters and all that at the start, because you think I just got to get through the next day. And of course, once you've done a week or two of those, you're no good to anyone, especially not to your loved one. So I think just realising that, I wish I'd been able to step back a little bit and make sure I take care of myself, get some good sleep and all that. That was probably one of the biggest ones that I think I wish I could know. And the other thing too is there was some, and I'm sure all of us can speak to this, some bad days at times, some days that you really thought you'd never get through. And I sort of learned that, one, to sort of jump off the roller coaster, but two, tomorrow can always get better. And I wish now, I'd just known how well things can turn out. Some dark days that you thought you'd never get through, and realising that there's normally light at the tunnel, and there's always hope and things like that. So you never forget that during those tough days.
Yeah, and I think that's right, because at the time you're just so involved with it, and everything's just feels so much overwhelming that you can not be focusing so much on the light at the end of the tunnel, as you call it. So just on that, I thought I might weave in a bit of that self-care, given you brought it up as well. So what things did you do, apart from taking yourself off the roller coaster, as you called it? What other self-care things did you do?
Actually, probably I did it really badly. So an example of probably more so is what I say, not what I actually did. So I was, as I said, threw myself into it a bit like John. I think I was at the hospital every day for nearly 12 months or so, from morning to night. And I sort of learnt as I went that I needed to get away. So I'm a bit of a runner. I love running. So getting away and being able to run around the Cairn or run around Albert Park was really, really nice. And even just getting away for being at a coffee store, even just by yourself, just having 20 minutes just to sort of forget about the hospital world. I probably got caught up eating lunch too much in the hospital, and that you really kind of focus. Your life you can't break away from the hospital situation, nurses and everything. So really advice for others, get out, even if it's just to a cafe store half, 100 metres down the road, somewhere that's out of the hospital environment, get that nice break, and you do actually get quite well rested and, like I said, get away for a run or a walk around the block or something like that. So I think that little bit of separation with your mind is really good for you, and it does recharge the batteries to be able to go back in and and refresh and go back into the hospital.
Yeah, and I think that's really important, because the hospital almost becomes like your second home. You don't really want that. And there's plenty of places around the Alfred too. So wandering over to the park or grabbing lunch elsewhere, there's options. So yeah, that's a good tip. And John, what about you? What did you wish you'd known earlier?
Well, I wish I'd known how little people understood what transplantation of lungs does to people. And if we've got grown-up children, and both Hal and I were retired when all this happened, so that was good. I didn't have to sort of report back to work. But people really have no idea what a transplant person goes through. They sort of think, if you had a transplant operation, you'd be playing tennis next week. And even our grown-up children, they were not. It took them a long time to realise how bad things were. We have friends that sort of abandoned us because, nobody wants to be around sick people, and lack of understanding there. I didn't have any of this knowledge, but I did have one piece of knowledge, and that is most of my life I suffer from depression. I either don't produce enough serotonin for myself, or I've got faulty serotonin receptors. And when this all happened, the first thing that I did, and thank goodness I did, was go to a doctor and get some medication for that. So I got put onto citalopram, and that was a real lifter for me, because I sort of thought to myself, well, I can't become useless at this point of time. Throughout my life, I could have become useless, and no big deal. Helen was healthy, but at this particular time, no. So since that day, I've been on this medication to keep myself out of depression, and it works. And it has helped me cope with the fact that people sort of do abandon you. They don't understand what's going on, and as a result, they sort of see you less and less. Even some family members. So that's something that I didn't know before it was going to happen.
Yep.
But that would have been a bit of a help, but we got through it. We are getting through it.
Yeah, I can understand that, because I think people are used to you and the patient being a certain way and being socially active with them, and often people struggle because you might get a few visits in the hospital perhaps from people, and then after that, especially in your case where it was a long time that she was in the hospital, people are waiting for them to get better and to get back into things, but often, like we've talked about, they become version 2.0 and they can't do all of that.
Yeah.
So,
and there's guilt associated with that too. If I just said, like, guilt from Helen's side, she feels guilty that she's become a burden. That's something else that you've got to cope with. She feels guilty because she used to be as fit and healthy as me, and we used to do everything together, housework, everything. And now she can't do any of that stuff. And so, she's gets times when she's almost on the verge of depression, that, she's a burden. And I just say, well, you're not a burden. Our lives have just gone a different direction.
Yeah.
And we try and maintain as much of our normal life as we did before, except I do the things now.
Yeah.
So, we go away in our caravan, but we don't leave the caravan until 11 o'clock because she's had a breakfast, she's had a medication, she's had a couple of hours to recover from the medication, and then we leave, which is different to what used to be the old life.
Yeah, you have to adapt, don't you?
Yeah.
And
but the guilt is there.
Yeah, well, look, there is a lot of guilt, both on the patient's side and I think the caregiver too. So yeah, I think that's something that all transplant patients and caregivers would have an experience of. So good one to bring up. Now, Bernie, what about you? What's something you wish you'd known earlier, and some of your self-care tips?
Well, I guess the roller coaster ride that it is, there's lots of hiccups on the way, and, you just go with it. You just, we have faith in our doctors, that they're, looking after our daughter in, the best way. So I guess, and also that, sometimes things change. Like, you have plans and sometimes it doesn't work out. I think it's just sort of, I don't know, going with the flow, just yeah, this can be crazy. But yeah.
Yeah, no, you're right. Ups and downs is part of, well, it's part of life, and I think it's heightened when you're going through these sorts of experiences. So, not putting pressure on yourselves to stick to plans and just to work with what you've got. And what about self-care? Because I suppose as a parent, it may be a different angle there. So.
Yeah, so caregiver, like I find that weird because because I'm a parent, so I'm a caregiver.
Right.
But I do sometimes think, because I know it's always meds, off by heart. And sometimes, I might forget and Tony will ring me at work. Oh, what are the meds, So, I've lost my train.
To self-care. So do you guys take it in turns or do you take time out from? How do you manage?
Try and get to do some exercise, So, but it's tricky with the kids, and but try and get some time out. Tone and I, now they're getting a bit bigger, we can both go out for a walk together, walk the dog, So which is quite nice. So so it happens sometimes.
Yeah, and I guess as a parent, you're probably and like you said, it's a weird calling it caregiver, really. You're a parent, and so you're with your child more than maybe we would be with our partners and other people anyway. So it's sort of combining that with what you need to do for her medically. That's very interesting for anyone, and I know there will be some other parents watching this, so that they'll find that useful. And Rihanna, what about you? What had you wished you'd known earlier in some of your self-care?
I think following on from what Ian was talking about, I wish that I'd had more of a concept of what we've all spoken about tonight, the version 2.0 of your loved one. Because in my case, because Mum had a long, drawn-out illness leading up to her transplant, everybody sort of viewed the transplant as the magic bullet, and she would go back to a version of herself that we remembered from before her condition had deteriorated so much. But that we've found that definitely has not been the case. I'm sure there are transplant recipients, I've seen them at the hospital, Wendy, you're an example of it, who have gone on to have very full and fulfilling lives after their transplant. But I do wish that someone had been quite frank with us and said, actually, that's not always the case. Whilst Mum doesn't have, the shortness of breath and the tiredness associated with chronic lung problems that she had before, she has a lot of other things that, she's been on steroids for 10 years now. So she's got really bad osteoporosis from prolonged steroid use. She developed diabetes post-transplant from the steroids. There's a lot of conditions that go hand in hand with the medications from the transplant I mentioned before we were recording. She's gone on to develop heart failure. So it's not necessarily, and I don't want to sound super negative, but I think it's important to be realistic that the person that you love is not necessarily going to magically come back to you. And the other thing that I really found, and Bernie, you might find the same with your daughter. With my mum, I have had to really get some strong backbone and be the bad guy at times and sort of say to her, no, you can't eat that. I know you love, pickled herring on bread and camembert with biscuits, but you're not allowed to eat those things anymore. And, we might have a family gathering that there would be, 40 people at, and 15 of them are kids under 5 that all go to daycare. And I have to say, Mum, I don't know if it's the best idea for you to come to this event. I know you really want to see everyone, but it's the middle of winter and all those kids are going to be snotty, mucousy virus machines that you're going to end up in hospital. And that is really challenging, I suppose, that change in the dynamic of our relationship from her being my carer as a child to now that being flipped. But I mean, I love her. I want her to be happy. So I don't want to have to tell her, no, you can't do the things you want to do and things like that. But you sort of have to at times.
Yeah. And so you mentioned earlier that, you all made a family decision, so that your mum would get the care that she needed day to day. And so that was obviously a really good thing for you and your brother and others for a caring point of view. Is there anything else that you do to kind of, give yourself time out or other things?
We've found since we made that decision that it's really helped balance the caring needs.
Yeah.
My brother and I kind of get together once a month or so and compare our diaries, and he'll say, I've got stuff on at work in this week, I won't be able to do anything in that week, so I know in advance, and vice versa if I have commitments where I definitely won't be able to do anything. We sort of support each other that way. We give each other like blackout periods, I guess, where you need to tag in and take over.
I think that's a good insight too, because if you are going to be asking for help from others, give them a bit of notice if you can, so that they can actually be there. Well, I think we've answered quite a lot, but I'd just like to do one more round of anything else you'd like to add to the conversation before we wrap up.
I think one thing that I'd like to add, and I think it is, as we sort of mentioned earlier, it can be a really tough situation. And as we mentioned, for a couple of us, it was really an unknown situation. And that was on for the carer side, but also for the patient and our loved one. So I always sort of make sure you're gentle with them and, understanding of them. Like, they might be dealing with a lot of, side effects from medication, a lot of changes, a lot of, and sometimes that comes out as anger, sometimes it comes out as frustration, fear, a lot of sort of different feelings. So don't take sometimes that personally, that those things that might come back at you, or the things that occur. Just remember that, that person's there, he's, doing their best, and they still love you, and, and so forth. So always make sure you just take care of each other in that way, and be gentle on both sides. So that's one thing. And one other thing, everyone's journey is very different too. As we've spoken, I think all 4 of our and 5 of our journeys are very different. Some are planned, we had a lot of steps beforehand, some were quite quick. Some, so if you're out there and don't sort of feel, you might hear the doctors talk about someone else, that doesn't mean that's your journey. If you hear there's no plan of, okay, I'm going to be in hospital for 3 weeks and then I'm out in the apartment for 9 weeks, and that's the exact plan. It's, everyone's different. Some are in hospital for longer, some might be a bit shorter. Some might need to be in rehab for a bit longer. It's all different, so don't sort of feel there's a set plan to it. So just go with the flow, and and see how it goes. But
and I think that's a really good reminder, because I can almost guarantee every single patient has a different journey, absolutely, and every caregiver will have a different journey as well. So just stay on your path, and do the best you can, because we are not all perfect, and like you said, sometimes it can get really emotional, and I know quite a few people who've sought help with that as well, because you really want, if in this case a partnership, a marriage, whatever, to stay strong too. So you don't be afraid to reach out and get support if you're struggling to deal with their anger issues or their frustrations, because there's people that can help you within the hospital as well, and that give you some tips. So that's a good one. And Bernie, before we wrap up, what would you like to share? Anything else?
No, I totally agree with what Ian was saying, but no, I don't think I have any more.
No, that's fine. I mean, I guess from a parent point of view, having a child who maybe doesn't understand what they're going through must have been really challenging. So that was probably part of your journey, whereas the rest of these guys are dealing with adults who have some understanding of perhaps what they're going through. So I imagine that was another challenge as well.
Yeah, absolutely. But I think, like, we were always very, open about what was going on.
Mm-hmm.
So I think, yeah, so there was some understanding, but as to how much, you know, and now I think things are changing, just getting a bit bigger as well. And you know,
she understands. Yeah, and with the siblings, did you have to make a concerted effort to, you know, spend time with them as well as her and try to balance all that? I mean, that must have been hard too.
Yeah, absolutely. And I think now as well, like I try and spend a time, because, you know, Zoe we spend a lot more time, I guess, going to appointments. Still, we still might try and do something special afterwards, or, you know. So we both try and spend a bit more time one-on-one with the boys as well, but obviously need to probably do that a bit more.
Yeah,
so
yeah, just a balance. Yeah. Oh, that's great. All right, well, thank you for sharing that. And John, anything you'd like to add?
Well, I guess I reacted to Rihanna's comments about some of the other conditions that come into play, like, you know, after you take all these medications, you know, Helen Mark II or Helen 2.0, osteoporosis, the skin's as thin as paper, a macula started to break down, cataracts, cholesterol, and they've got to go and see doctors about all this. And it's very demanding, depressing, and it makes them feel bad. And what Ian said, yeah, sometimes they may lash out. They don't mean to, but they may lash out. And you just got to go along with the ride for that. But we didn't know about all those additional things that come into play as a result of trying to manage your body from an external point of view and shutting down your immune system. Everything's got to be done manually now. We take everything for granted when we're healthy.
Yeah, that's very true. And I believe, I could be wrong, but I believe that lung transplant patients and perhaps other transplant patients too actually have the most connection or touch points with other departments in the hospital. So we do use a lot of their resources. You know, it's not just necessarily seeing the lung transplant specialist. There's a whole heap of other departments that you're involved with as well. So you become almost an expert at the hospital and you become a familiar face. And hopefully it's not your second home, but it sometimes feels like it. So yeah, no, thank you for adding that. And lucky last, Rihanna, anything else you'd like to add?
No, I don't think so. I think we've covered sort of a lot of perspectives and a lot of, you know, variables that come with this journey from what we've discussed so far. Yeah,
it's certainly been interesting for me too as a patient. I'm going to maybe have a chat with Gordon after this and just apologise for the times where I got a bit out of control and a bit frustrated, because looking back I was probably like that. So yeah, it's a good one. So maybe patients watching this too might be a bit of a reflection to be a bit kinder to their caregiver. So on behalf of all the patients, I'd just like to say a big thank you to all the caregivers, because I think patient journeys are actually improved when you have a caregiver who's supportive. So yes, thank you for all you do. And we'll wrap it up there, but we will have future videos like this, and we do have a caregivers page on our website where we're going to keep adding new resources as well, and we're always open to suggestions too. So thank you everyone, that was excellent.